And I'm going to introduce Paul first. Paul Viviano is the CEO and president of Children's Hospital Los Angeles, one of the 8 freestanding children's hospitals in California. He, before that, was at UC San Diego, CEO of the health system hospitals down in San Diego, but CHLA was very fortunate to pluck him right out of there and bring him up here. And he was also, before that, at USC University Hospital as CEO, so been at a lot of academic institutions very well. And then had spent quite a bit of time in the St. Joseph system also. Paul has also recently been elected to the board of directors for HASC, Hospital Association of Southern California. So we wanted to mention that. Paul?
Thank you, Lisa. Thank you for the invitation this evening. I wanted to first acknowledge our namesake, Dr. Paul Torrens is here. Paul, thanks for joining us this evening, and welcome. Paul has been a mentor and advisor for more decades than either one of us care to remember, but I'm not sure he'll claim me anymore, but it's really a pleasure to be here. So I've, at least I said, I've been part of the children's healthcare world officially for about 8 months at Children's Hospital Los Angeles, and there are a lot of special and unique things about healthcare delivery to children and in the pediatrics world, and I'm going to just mention 2 of them before we get started officially. The first is there is a remarkable amount and level of cooperation between the children's hospital providers in the state of California. They collaborate and cooperate around doing zero harm to patients and to sharing best practices. Ann mentioned the triple aim. We collaborate and cooperate and share virtually any information, both within the state of California as well nationally. If we call anybody in the children's health world, they will share whatever information we request virtually without hesitation. And it's very unique. You don't see that in the adult world. The second thing is, and Ann referenced it, and we're going to spend a little time talking about it this evening, is the business model for this is under a lot of pressure. When you see 70% plus Medi-Cal for a handful of the big providers here, most of them are well over 50, it's challenging. And so while you see these enormous investments that are being made in children's healthcare today, the model's under a lot of pressure. So we're going to talk about that a little bit. And you see our kind of our tagline, we treat kids better, and we happen to believe that. So the beginning of this might feel like a little bit like a commercial. It isn't meant to be, but it is meant to really reflect the enormous investment that has been made at Children's Hospital Los Angeles for the last 115 years, where we are a true pediatric academic medical center. We have 200 plus residents and fellows. We have a freestanding independent research institute. We have a clinical enterprise, all 3 of which are ranked in the top 10 in the United States. And so the size of this reflects that enormous investments across the entire continuum of children's healthcare have been invested. And we do have a very close working relationship and affiliation with USC. So I promised our board when I started that I would never start a presentation without reflecting initially our mission and our values, and so they are reflected here, and it is a source of great pride that we focus on creating hope and building healthier future for children, and it's a marvelous mission. So a lot of recognition, and again, these represent just very, very significant investments that we're incredibly proud of, and without the philanthropic support of the greater Los Angeles community, this literally wouldn't be possible given the financial economic pressures that we face in pediatric healthcare today. So again, just a few really important elements of this. I mentioned the residents and fellows, the medical students. Today there are 1,200 pediatricians who are graduates of our residency program. Almost all those 1,200 are practicing here in LA County. To be a freestanding pediatric academic medical center, again, represents these investments. And reference CCS. There are 31 CCS programs. We are certified in 30 of them, which again just reflects the breadth and scope of services. And again, you see the size of our research faculty and the projects that are underway. So we'll talk a little bit about the economic reality of this, and then we'll talk a little bit more about the differences between the actual care delivery before we turn it over to Dr. Siegel. And so reimbursement is challenging. So 5.2 million children, 50%, of the state's total. And so within a 2-hour drive at Children's Hospital Los Angeles reside 2.4 million children. And that is an enormous obligation and opportunity and challenge for all of us who are providers in LA County. And so there is this perception that we get a lot of special extra money, and that there is some truth to the provider fee income stream that is represented to children's hospitals, but it's a stretch to call children's hospitals in the state of California highly reimbursed, and again, just a lot of pressure. And so you see today, again, reflecting on the slide that Ann highlighted earlier, for all the children's hospitals, about 3/4 of our volume today is Medi-Cal. And just one little fact, we were reviewing this the other day, we did 10,000 outpatient surgeries at Children's Hospital Los Angeles last calendar year, 10,000 outpatient surgeries. Anybody want to guess what the average reimbursement, including provider fees, was to us for the average for those 10,000 surgeries? $300. You can hardly turn the lights on in this building, let alone in an OR, for $300. 300 times 10,000 was the total reimbursement for Medi-Cal for those outpatient surgeries. Hard to make ends meet with that level of reimbursement. So that's our economic reality. And so we've gone on a campaign here in Los Angeles to reflect this advertising that when you have a sick child, they really belong in a children's hospital. And so inadvertently we stepped on a few toes with this, but didn't really mean to. But it is making a point that there is a significant difference, and Lisa referenced it. Pediatric trained subspecialists, medical and surgical subspecialists, make a difference, and that represent a very significant investment. So here's the example that we'll use tonight. And so cancer in a child is obviously an inherited condition, and you see the very significant differences in the most common occurrences of cancer between children and adults. And so on the adult side, you see breast, prostate, lung, and that's something that makes a significant impact on adult providers. And all of us stay awake at night worrying about our loved ones who have been impacted by this. For children, it's different, and you see ALL, brain and other CNS tumors, and neuroblastoma. A very significant treatment regimen is called for and requires different training. And obviously, as you think about surgical interventions, as you think about chemotherapy, radiation therapy, the level of care and concern that needs to be administered for these young, precious children who will live with this, the treatment side effects, the rest of their lives. And so this approach has to be very, very carefully coordinated, and this clearly is among highly trained specialists who are aware of the implications of these treatment regimens and how they will impact patients going forward for the rest of their lives, hopefully very long and satisfying and gratifying lives, but does have an impact on how care is actually delivered. And so here's my last slide. This is from our Chief Medical Officer for our health system, Dr. Robert Adler, who many of you know. He's been around for a long time and is widely regarded as a mentor of many pediatricians trained in Southern California. And so, God forbid, at your darkest hour, your child is sick, to be calling someone who's specially trained, a pediatrician, specialist, surgeon, oncologist, cardiologist, whatever that need is, to have that available readily to care for your child is what we are all called to do in children's health care. And so we have the pleasure and the honor of caring for these young patients and working with their families to help them meet their needs at that time. And it requires my theme, a very significant investment, a recognition of how special it is, and the role that we play in this community is very significant. So I look forward to your questions and the opportunity to address any concerns that you might have about what's been presented tonight. It's an honor to be here, so I'll turn it back over to Lisa. Thank you so much.